Welcome back, Sunrisers. Now, some of our viewers have a few questions anonymously that we would like to help them with. Joining us to give his expert opinion is consultant urologist at the UWI Mona campus, Professor William Aiken. Welcome to Sunriseville.
Thank you, Raymond. A pleasure to be here.
And it's an honor to have you here. As a matter of fact, for the entire month of October, we're giving some focus on prostate health. September, yes, sorry, on prostate health. And we've had some feedback from our viewers and questions that generally we think the information must be provided to the wider public. So the first one up is, how important is screening to fight against prostate cancer?
Thank you for that question, Raymond. So screening is exceptionally important. It is the #1 method to prevent early death from prostate cancer. In screening, what we do is take a person who is asymptomatic, meaning a person who has no symptoms. And early prostate cancer generally does not produce any symptoms at all. And we subject that person to the screening test, which is usually not a definitive test, but if the screening test is abnormal, a further confirmatory or definitive test is done, which in the case of the prostate would be a biopsy. So the screening test for prostate cancer are the well-known digital rectal examination and the blood test, the prostate-specific antigen test. If either of those is abnormal or if both are abnormal, then the man would go on to having a biopsy done, usually preceded by an MRI test.
So we're going to throw to a voice note now from one of our viewers.
At what age should men get their first testing for prostate cancer?
In the Afro-Caribbean region, where prostate cancer is the #1 cause of cancer-related deaths, and men of African ancestry are at higher than usual risk, we, and by we, I am referring to the Jamaica Urological Society and the Jamaica Cancer Society, we recommend that men start screening at the age of 40 years. 40 years. If you are Caucasian and you have no family history, then the age to start screening is 55 years. But in a high-risk population such as ours, 40 years is a recommended age to start screening.
And that's because the earlier you detect anything, the better it is in terms of the likelihood of successful treatment.
Absolutely, and because a higher proportion of our men present with prostate cancer than in other populations.
Right. All right, so we're going to our next voice note, Prof.
It is said that guinea hen weed can reduce an enlarged prostate. Is this true?
Right, so guinea hen weed is in the process of being studied. Currently, there is no hard scientific evidence that guinea hen weed can reduce the size of the prostate or can prevent the occurrence of prostate cancer. So at this point in time, we could not recommend guinea hen weed as a preventative measure for prostate cancer.
Are there any other teas like we've seen in the literature? And by literature, it's not necessarily research literature. A lot of us will go straight to Google or worse, WebMD. Is it true that green tea has a significant impact on reducing an enlarged prostate?
Yes, so in Southeast Asia, where green tea is consumed in great quantities, and as you know, green tea has potent antioxidants. There is what we call epidemiologic evidence, or evidence where they look at populations of people and look at what they do and their lifestyle factors. There is a correlation between drinking lots of green tea and a lower risk of prostate cancer. It is not hard evidence, but there is some scientific evidence that green tea does prevent prostate cancer.
Okay, we have another voice note, Prof.
All right, Doc, I know there's a stigma attached to the whole testing procedure for prostate cancer among Jamaican men. What advice would you give to men in order to break this stigma so that we can take our health more seriously?
Okay, so that's a loaded question, and it is true that indeed there is a stigma, especially related to the digital rectal examination, where the doctor puts his or or her gloved and lubricated finger in the rectum to feel the surface and consistency of the prostate. We say to men, look, if you do not want to have the digital rectal examination, still come and we'll do your blood test, the PSA. But bear in mind, if only the PSA is done, there is loss of information, because there's some information that you can only get from the DRE that the PSA cannot give you. As a matter of fact, the two tests are complementary. They complement each other. At some point in time, the DRE must be done, because that's how we locally stage prostate cancer if it is present. So whether you do it at screening or whether it occurs later on, at some point in time, it must be done. But, you know, I say to men all the time, look, women, when they are screening for cervical cancer, they have a speculum inserted in their vagina. The walls of the vagina are pushed apart for the doctor to be able to get a sample. And that is uncomfortable, that's painful. It takes a lot longer than having a digital rectal exam, which is only 10 seconds or less if it is being done by someone who knows what they're doing. So I say to men, don't be a wuss, or lady folk go through a lot more.
Yeah.
You know, when you have a mammogram, it hurts because the breast is squashed. So a digital rectal examination, yes, it's invasive, yes, it's uncomfortable, but it could save your life.
Yeah.
And, you know, I would recommend men to overcome that stigma and have it done.
Yeah, it's one of the most important 10 seconds that you will get over very quickly, and the value of the information that is provided as a result of the DRE for your own health and quality of life over a longer period of your life is well worth it. Thank you very much, Professor William Aiken, our guest this morning, consultant urologist at the University of the West Indies and professor. It's time for a short break. When Sunrise return, it's all about saving lives with the Jamaica Cancer Society and Guardian Life. Stick and stay with us on Sunrise.
You know, sound serious.